And CEO of JenWorks Health. Over the last 25 years, he has been driving adoption and transformational and emerging technologies and their commercial applications with consistent track record of influencing market growth by improving penetration of these technologies to enable higher quality of care. Welcome.
Thank you. The topic is taking healthcare to the last mile, and a lot of context has to be built as to around what has to be done and what JenWorks can do to better that. Fundamentally, we all agree that the healthcare is underserved. We clearly agree that access is a problem, and that's the last mile. The last mile, the gap, according to me, is that we can keep saying that why are doctors not changing them, why are they not adopting technology, but then what effort have you made to take it to them? So today, what are we doing in JenWorks? Why has GE created JenWorks? GE has made all the efforts to create products that are relevant, affordable, but through JenWorks, they have also made sure that they create a distribution arm which has the capability, which has a scale, and which has a capacity to take these products, to take these technologies to the physicians across the country, and only then we believe that we can realize our mission of working for healthier India. So that's why JenWorks. So JenWorks, fundamentally what we are going is inspired to take all the technologies, not just GE healthcare technologies, all of the technologies that are relevant for these markets. JenWorks is going to take these products to the markets, and very clearly we understand the role of educating our employees, building their ability to go and engage with doctors, explain them. So we have created a JenWorks Learning Academy, which focuses on the internal training. We also want to be able to sell solutions and make them use it for improving their outcomes. So finally, what do we want to do? The focus is on improving diagnostic services. The focus is on building infrastructures, building hospitals, building affordable care, and we certainly are connected in all of this. We are going to drive this through KOL programs. We are going to drive through tabs with physicians. We are looking at some ideas already to make sure that how we collaborate with physicians to help to make sure that we use Holter and ECG as a part of completing their cardiac screening. So it's fundamentally all about enabling, and that's the JenWorks purpose, to get the best in class technology, get the most affordable and the most relevant technology, partner with the best-in-class healthcare providers, and provide solutions to Tier 2, Tier 3 towns to enable outcomes. And that's all what we want to do in JenWorks.